welcome back to the deep dive. So, being a medical microbiologist, we're always trying to figure out what's causing these gastrointestinal infections, right? And those cultures, well, sometimes they can be a bit overwhelming.
Definitely a lot going on there.
So today we're diving deep into an algorithm that'll help you analyze those GI cultures. And this is all based on some pretty cool insights from an AI tool called Gemini. I think it's really changing how we look at GI infection analysis.
Oh, absolutely. Gemini has been working hard, analyzing tons of data, lab stuff and patient info, really helping us understand this complex world.
It's funny. We all know there are a lot of bacteria in feces, but I was blown away. Did you know it's like 10 bacteria per gram?
It's incredible, right?
It's like a whole galaxy.
Yeah.
And each one of those little guys, they're causing trouble in their own way. Some latch onto the intestinal lining, and others, well, they're producing toxins that mess up the whole water and salt balance.
It's a microscopic war zone in there.
It really is.
Yeah.
But what's interesting is, how something as simple as stool consistency, whether it's watery or bloody or formed, can be a major clue in figuring out what's going on.
Absolutely, like puzzle pieces, right?
Exactly. And today, we're putting those pieces together. We'll be looking at what Gemini have found to make a practical algorithm, something you can use right in your lab, ready to dive into these GI cultures.
Let's do it.
Okay, first up, PCR. I know, it's pretty basic, but Gemini really points out how important it is for GI diagnostics.
Definitely. We can use it to find the usual suspects: Campylobacter, Salmonella, Shigella, Placimonas, Aeromonas, Yersinia, straight from the fecal swabs. And if someone's been in the hospital for more than 3 days, we can even look for Clostridium difficile. What's great about PCR is that we can focus our cultures based on those results. No more wasting time, on cultures we don't need.
So it's kind of like our initial recon. It tells us where to go next.
Exactly.
But what about those cases where we don't find the usual suspects or the patient's history, suggests we need to look at other possibilities?
That's where the algorithm gets really interesting. Gemini helped us come up with a way to decide which cultures we need based on the clues we have. For example, let's say someone just got back from a trip to the tropics and they've got watery diarrhea. We might think about Vibrio, even if the PCR doesn't show anything. Or, if there's blood in the stool, we'd need to consider Shiga toxin-producing E. coli.
So it's a personalized roadmap, basically, right?
Yeah. It guides us to the most likely causes based on what's going on with the patient.
Okay, so let's say we've picked our targets and we've got the cultures going. Now what? Those bacteria, they can be a bit picky,
They really are. But luckily, Gemini helps us figure out the right media and the right conditions for each one. It's like a recipe book for growing bacteria. Agar plates, temperature, the whole 9 yards.
Okay, so we've plated the cultures. They've been incubating. What's next?
Now comes the fun part. We get to examine those colonies. We look for clues that tell us what they are. Size, shape, color, texture, it's all there. Like a secret code.
Oh, I like that. So what kind of cool codes did Gemini find when looking at colony morphology?
Well, for one, did you know that Yersinia enterocolitica can look like a bullseye on CIN agar?
Really?
Yeah, it's like a little target. And then there's Campylobacter. Sometimes it has this metallic sheen on CCDA agar, like a tiny mirror.
That's pretty wild. So we can tell a lot just by looking, but sometimes those visual cues aren't enough, right?
Right. That's where agglutination tests come in, especially for Salmonella and Shigella. Basically, we expose the bacteria to antibodies. If they match, they'll clump together. Classic confirmation technique.
They'll double check, right?
Exactly.
But Gemini found something interesting about this, didn't it?
It did. Apparently, some Salmonella strains, well, they need a bit of encouragement. They need to be boiled to show their agglutination properties. Who knew bacteria could be so shy?
It makes you wonder what other secrets they're hiding. We've covered PCR, cultures, and morphology, but what about, there's one big piece missing.
You mean sensitivity testing?
Exactly.
Yeah.
Because we need to know which antibiotics will actually work against these bacteria. It's important for treatment and preventing resistance, right?
Couldn't agree more. And Gemini has given us some great insights into how to make sensitivity testing better, choosing the right method, whether it's disk diffusion, e-test, or VTEC2, and making sure we're interpreting the results correctly.
So we've covered a lot, from PCR to colony morphology and sensitivity testing. But now it's time to put it all together. What do you say?
Sounds good to me. Let's look at some real-world examples and see how this algorithm works in practice.
All right, let's get our detective hats on. Time to solve some cases.
All right, so are you ready for our first case?
Yeah, let's do it. I'm really curious to see how this algorithm plays out.
Okay, so picture this. You have a 25-year-old patient who just got back from backpacking through Southeast Asia. Lots of interesting food choices there. Uh-huh.
And now they have watery diarrhea and those awful abdominal cramps. No fever, though.
Oh, classic traveler's diarrhea. So using our algorithm, where do we start?
Well, we always begin with the basics, right? Patient history, symptoms, the recent travel, that's a big clue. And the watery diarrhea without a fever, that probably means it's not an inflammatory thing.
So maybe we're thinking Campylobacter. That's pretty common with traveler's diarrhea, right?
Yeah, good thought. But we don't want to jump to conclusions just yet.
Right. What's the next step?
We need to confirm our suspicions. So we run the GE-PCR panel. We're checking for the usual bacterial culprits.
Okay.
But while we're waiting for those results, we can start thinking about other cultures based on, this specific patient.
Ah, you mean like using that personalized roadmap we were talking about?
Exactly. In this case, because they were traveling and have watery diarrhea, we might want a culture for Vibrio species, even if the PCR comes back negative.
So we're being extra thorough, and let's say those PCR results come in and it's positive for Campylobacter. What happens then? Well, we need to know exactly which species it is, right? Most likely it'll be Campylobacter jejuni or Campylobacter coli.
Got it.
And that means remembering how picky these bacteria can be.
Time for that bacteria recipe book.
Yep. For Campylobacter, we'd use a special media like CCDA agar, and we have to incubate it in a microaerophilic environment. Campylobacter prefers low oxygen.
Right. Got to make those little guys comfortable. So now that we've got them growing, what do?
Well, next we'd do sensitivity testing. Figure out which antibiotic will work best for this particular Campylobacter infection.
That makes sense. So case solved. Traveler's diarrhea successfully diagnosed and treated. This algorithm is pretty slick.
It definitely helps. But are you ready for a slightly tougher case?
Oh, absolutely. Lay it on me.
All right, so imagine you have a 5-year-old in the ER, bloody diarrhea, and a fever. Parents are understandably freaking out.
Yeah, that sounds more serious. Bloody diarrhea, fever, that's got to be inflammation, maybe something worse.
You're right. In this case, we'd be thinking about pathogens that can cause, more severe infections.
Right.
We'd start with that GE-PCR panel again, of course. But we also got to look at our roadmap for other culture needs.
And because it's bloody diarrhea, we'd be thinking about Shigella toxin-producing E. coli, right?
Bingo! STEC, especially E. coli 0157, that can cause some serious problems, so we have to be careful. We'd want to order that specific STEC PCR test and be ready to culture on SMACI, BLD, and CLED agar if it's positive.
Okay, so let's say that STEC PCR is positive and it's growing on the plates. What's next?
Time for more code breaking. We look at those colonies carefully, see if there's anything that screams sec. On SMA, agar, E. coli 0157, it often doesn't ferment sorbitol. So the colonies are colorless with a brown center.
A non-fermenter. That's a good clue.
It is. To be absolutely sure, we'd send it for serotyping. That way we know exactly which strain of STEC we're dealing with.
Makes sense.
Yeah.
And then sensitivity testing to find the right antibiotic, right?
Exactly. You're getting the hang of this. Okay, how about this? A 70-year-old patient, recent antibiotic use, they've got this persistent diarrhea, and they've been in and out of the hospital multiple courses of antibiotics in the past.
Oh, that's a tricky one. Antibiotic use, that's a red flag for sure.
You're thinking like a microbiologist. This scenario, we'd be super suspicious of Clostridium difficile infection, especially with the recent antibiotic exposure.
Right, C. diff, it's a real problem, especially in hospitals and people who've had a lot of antibiotics.
Yeah.
It can be mild, but it can also get really bad.
Absolutely. Given the patient's history and symptoms, we'd order that PCR test specifically for C. difficile.
And if it's positive?
Then we need to make sure it's actually producing the toxin. So we'd culture the stool on special media like CLO agar that helps C. diff grow and keeps other bacteria in check.
Gotcha. And of course, sensitivity testing to guide treatment.
Exactly. Finding the right antibiotic for C. difficile is crucial. Okay, ready for another one? 30-year-old patient, watery diarrhea, abdominal cramps, no recent travel, no fever, no blood in the stool. But the GE-PCR panel, it's negative.
So none of the usual suspects. What do we do when the PCR doesn't give us an answer?
Well, now that personalized roadmap is even more important, we need to think about those rarer causes of gastroenteritis, the ones that might not be on that standard PCR panel.
So thinking outside the box a little.
Exactly. In this case, because it's watery diarrhea and there's nothing else going on, we might suspect Aeromonas or Plesiomonas. They're often found in contaminated water.
Interesting. So even though the PCR was negative, we're expanding our search based on those other clues.
Exactly. We check our bacteria recipe book, find the right media and conditions for those less common pathogens, and if we see anything suspicious, we need some more tests to confirm.
And then sensitivity testing to guide treatment.
You got it. This case really shows how we can't just rely on PCR. We need to use all the information we have. It's like being a detective, you know?
I'm loving this detective work. Ready for one last case.
Let's see if you can crack this one. We have a 60-year-old patient, history of liver cirrhosis. They have fever, abdominal pain, and diarrhea. The GE-PCR panel is negative.
Liver cirrhosis, huh? That definitely complicates things. What should we be thinking about here?
Well, when someone has liver cirrhosis, their immune system is weaker, so they're more likely to get opportunistic infections. One possibility here is Listeria monocytogenes.
Right, Listeria, it can cause some serious problems in people with weakened immune systems, so we need to culture specifically for that, using LIS agar.
Exactly. And if we see those black colonies with the black halo, we'd confirm with more tests and do sensitivity testing to figure out the antibiotics.
Makes sense. This case really shows that we have to look at the whole patient, not just their symptoms.
Absolutely. It's all about connecting the dots.
You know, I'm feeling pretty good about this algorithm now. 5 cases, 5 successes.
I agree. I think you're ready for a real test.
Yeah. What do you have in mind?
How about a little exam, like
Yeah.
back in school, just to make sure everything's sunk in?
I game. Let's do it. Okay, hit me with those exam questions. I think I'm ready.
All right, first question. What's the biggest advantage of using PCR for gastrointestinal infections?
Well, I'd say it's speed. You know, PCR lets us find those common bacterial pathogens really quickly right from the sample. We don't always have to wait for those cultures to grow.
Exactly. PCR is like our fast track to identifying those usual suspects. Okay, question number 2. Why is stool consistency so important when we're looking at GI cultures?
Well, the consistency can give us a lot of information about what's happening. Like, if it's watery, that often means it's not an inflammatory process. But if there's blood, it could be inflammation, maybe something more invasive.
Spot on. All right, moving on. Question 3. What's the role of selenite broth when we're culturing for Salmonella and Shigella?
Oh, selenite broth. It's like it helps those Salmonella and Shigella grow, but it keeps other bacteria from taking over.
Exactly. It helps isolate the pathogens we're looking for. Now, for a visual challenge, can you describe what Yersinia enterocolitica colonies look like on CIN agar?
I remember this one. Yersinia enterocolitica, it often has that bullseye look on CIN agar. You know, red center, clear halo, like a little target.
Perfect description. You've got a good eye for detail. Now, let's talk about those confirmation techniques. Why are agglutination tests so important when we're identifying Salmonella and Shigella?
Well, agglutination tests are how we double check. They confirm whether those specific antigens are on the bacteria so we can be sure of the diagnosis.
Exactly. It's like our seal of approval.
Yeah.
But, and this is important, safety first. What precautions do we always need to take when doing these tests?
Oh, absolutely. We always have to work with Salmonella and Shigella in a biosafety cabinet. And of course, we wear the proper protective gear.
Good point. Now, shifting gears to treatment, what's the main reason we do sensitivity testing when we have a GI bacterial isolate?
Sensitivity testing tells us which antibiotic will actually work against that specific bacteria, so we can target the treatment and prevent resistance.
Couldn't have said it better myself. It's all about personalized treatment for bacteria. Speaking of which, what are the 3 main methods we use for sensitivity testing in the lab?
We have disk diffusion, the E-test, and VTEC2. They each have their own, quirks and advantages, but they all help us figure out how susceptible the bacteria are to different antibiotics.
You're on fire. Now let's think about experience. How can those old culture results be useful when we're analyzing a new GI culture from the same patient?
Well, if we've seen this before, it can be really helpful, especially if the patient has recurring infections. If we find the same bacteria and the sensitivity patterns are similar, it can save us from doing a lot of extra testing.
Excellent point. It's all about using the information we have. Okay, last question, and it's about teamwork. What's the most important thing to remember when sending those bacterial samples to another lab?
Safety, always. We have to make sure those samples are packaged and labeled correctly, following all the protocols, especially if we're dealing with, class 3 pathogens.
Mm.
And communication with the other lab is key, so they know what they're dealing with and we get accurate results.
That's a perfect score. I'm so impressed. You've really mastered this algorithm.
Thanks. It's been a really fun deep dive learning about this algorithm with you. I feel much more prepared to tackle those GI cultures now.
That's fantastic. Remember, this algorithm, it's a really powerful tool. It helps us get those diagnoses faster and ultimately provide better care for our patients.
Absolutely. And it's pretty amazing how these AI systems, like Gemini, are changing the game when it comes to understanding these infections.
It's definitely an exciting time to be in this field. New discoveries and technologies popping up all the time.
Well, that's it for this deep dive. We've taken you through the world of gastrointestinal infections, explained the latest techniques, and given you a practical algorithm for analyzing those GI cultures.
Remember, knowledge is power. Keep exploring and don't be afraid to ask questions.
And be sure to check out Gemini. It's an awesome resource for staying up to date on everything GI diagnostics. Thanks for joining us, and until next time, stay curious.
Stay curious.